Hi guys, so tonight we're going to do Sculptra. We continue with the topic of skin glow. We know that for a fact that Sculptra gives a beautiful skin glow. We did Skin Beef last time and now we're going to go with Sculptra. They're completely different treatments. Sculptra is not a filler, it's a biostimulator. It's poly-L-lactic acid. It's manufactured by Galderma. And it's a wonderful product for patients that are needing just kind of like a tiny little bit of like generalized volume. Your patients that are naturally thin, I always tell my patients like your marathon runners, your runners that are going to be kind of like a little bit more volume depleted on the face are your perfect candidates for Sculptra. And it's my favorite product for temple volumization. So it's wonderful for temples. We're going to do a tiny little bit of preauricular right here, and then a tiny little bit of silk mailer. Amy has done Sculptra in the past, and has done also Radiance, Deep to Bone, and Hyperdiluted. So her last treatment of Sculptra was years ago, right? Mm-hmm. That's what she said. Mm-hmm. And then her last Radiance treatment was 2 months ago. So we know that that one is still working, right? Because Radiance is a biostimulator as well, kind of like Sculptra. It takes 3 full months for you to see the final result. Sculptra has a newer protocol to be prepped immediately before treatment. That's what we're going to do. When I do the immediate reconstitution, I like to use the Vortex mixer. So that's what I'm going to use, so we can have like a more homogeneous fluid in Sculptra. I just find it easier than having to be taking it by hand, and it just works better that way. So that's what we're going to use today. Ideally, or when I'm doing Sculptra at the office, I normally like to reconstitute a couple of days before. It's just my old-fashioned way of doing it. I like to reconstitute it and keep it kind of like, I just mix it with the 8 cc's of bacteriostatic water, 1 ml of 2% Lido, and then I just keep it nice and steady there for like 3 or 4 days. And then right before drawing it into the syringes, I just kind of like swirl it a little bit. That's the way that I prefer to do it, but it's definitely an approved protocol to hydrate or to reconstitute immediately before treatment. So any of the two that you want to do, it's perfectly fine. So for the temple, I like to mark the suture line, the temporal suture line that you can kind of like see on her. If not, I just palpate, right? You can run your fingers through this area and you're going to feel that little dip, okay, where the temporal fossa starts. And then lateral canthus, and then around the long bone. And that's going to be your temporal area. And then for the feet, I mark my bone angle. I normally keep that 1 centimeter in front of that ear. And then for the, and there's protocols where you can go with Sculptra all the way over here if you wanted to. I normally try to, and she doesn't need much, but I normally try to keep it kind of like on the silk mailer area and the preauricular area. Normally, because of the line of ligaments that we have on the face right here, the mesenteric ligament, we also have like a little bit of fullness right there that it's kind of like dividing the face into. So I try not to put too much product in there either. So ala of the nose, and then normally we do mid tragus. For this one, we're gonna do all the way to the fold of the ear. So it's gonna be a little bit higher than the Hinder's lines that we normally do. Right where you see those kind of like that fold of that laugh line, that's where I stay behind here, right there. And we know that the big vessels are over here, right? So we're trying to stay away from those big vessels. That's why we keep the 1 centimeter in front of the ear, and then I stay kind of like 1 centimeter before that oral commissure. And we also know that the pre-oral area, right, the perioral area, it has a lot of like the muscles that are constantly moving and kind of like almost like touching each other. So you don't want to have a lot of Sculptra in that area because Remember that Sculptra is a suspension, right? That those little crystals are going to be floating in that bacteriostatic water for the first couple of days. So that muscle contraction can kind of like cause those crystals to kind of like do little clumps where those muscles are touching. So I try to stay in the areas where I know those muscles are not going to be constantly moving. That's one of the reasons why I don't do a lot of necks with Sculptra, because of the same reason, because that constant moving, I feel like it can cause that fluid to kind of like cause little clumps, and we don't want to have that. And then I divide the cheek in two, right, where we know we have those line of ligaments. And then if I see that they have like a strong masseter and they have volume right here, I mark it as well. So I don't want to add any volume right there. She doesn't have a lot, but we don't want to add too much. Normally, sometimes I will do like a deep injection on the gonial angle whenever patients need it. She has a beautiful jawline, so she doesn't need that. But you can do maybe like a 0.05 deep to bone with a 25 gauge needle. I would use the shorter needle, the half inch or the 1 inch needle, just to have better control on the syringe. And then do like a 0.05 and then continue to do the preauricular area and then the submalar area. She has good volume right here on the cheek, so unless I was doing deep injections, deep to bone with Sculptra, which you could, we're not going to do any today. So we're just going to spread a little bit of Sculptra right here, that submalar, and then a tiny little bit right here in the preauricular. Remember, in the preauricular, be careful with the parotid gland, right? Which we know it's nice and superficial right there. So I'll show you the depth. We're in dermis, right? So you're supposed to see kind of like the shape of the needle, but not the color of the needle. And you're going to see kind of like the fluid plumping the skin that you're working with, which is really nice. And then on the temple, I do the 1 up, 1 over of the Swift technique for the temple. So it's just one entry point, and then I normally do like a 2 cc, 2 cc's on temple, and then 2.5 cc's for the lower face. Obviously, depending on how much they need, right? I think she'll do fine with 2 cc's. Remember that with Sculptra, you're gonna see a little bit of the volume right away. And then the volume is going to seem like it went away, right? Because the water gets absorbed into your body. But those little crystals of the polylactic acid that are floating in the Sculptra are the ones that are going to slowly stimulate your collagen to the point where in 3 months, you're going to be able to see the result that you see today. Okay? Temple suture, narrow canthus. And remember that the technique, the one up, 1 over, they did it that way, right? Or they studied it that way because we know that the deep temporal artery is going to run kind of like close to the hairline. So that way we're staying kind of like away from it. There's patients where you can see even like the pulsation of the superficial temporal artery. Obviously you can see it, just stay away from it. But if you are in the 1 up, 1 over, you're supposed to be in a very safe area where you're not going to encounter the deep. Since we are doing periosteum injection, right, we're going all the way to the bone and delivering the product in periosteum. If you pierce the superficial artery, the worst that can happen is just a bruise, right? Because we're delivering the product from deep to bone. So sometimes the temples will bruise. I prefer this technique because I think it's like a cleaner technique. Whenever I do the cannula, which we can, right? I feel like it stayed kind of like bumpy for a couple of days, and patients don't like that. I wouldn't like it if I was a patient. So I prefer this technique, the 1 up, 1 over. So we know that the facial artery is going to be running around 1 centimeter away from the bone commissure. So staying a little bit behind, you're staying away from that artery as well. So we're going to have just a tiny little bit in the preauricular and then a tiny little bit right here in the submalar. And when we do that, right, because we're volumizing, or we are giving a little bit of volume where we're losing the volume, which is kind of like right here, this is going to get improved. So the nasolabial fold gets improved, the oral commissure, the kind of like the pre-jaw area, because we're pulling the skin backwards like this. So that's what I try to explain to my patients. So the same-day reconstitution calls for 5 cc's of bacteriostatic water, then mix very, very heavily for a full minute, and I actually put my phone on kind of like a timer, so I do exactly a minute, and then After that minute of heavy shaking, you do the other 3 cc's, okay? Because remember that the on-label reconstitution is 8 cc's of bacteriostatic water. And then I add the 1 cc of 2% iron as well. And then you mix again for another minute. We're going to do one at a time. And this little thing, it's kind of like your best friend. Oh, that's loud. Let me try to hold it in my hand. Let's see if it works. There. So it does the trick very nicely. Before I got it, I was like really tired after those full 2 minutes for each vial, especially when you're doing more than just 2 vials. When I do Sculptra, I do have my MA in the room helping me. She's constantly kind of like moving the syringes back and forth while I do the treatment, and that helps a lot. The Sculptra sediments so quickly that you really have to get the hold of how quickly you push the product. If not, then you end up with the product kind of like just sedimenting on the bottom portion where the plunger is. So if you notice that, or especially in the beginning, right, if you're going to be a little bit slower, just make sure that you kind of like re-suspend that Sculptra if you see that happening, and then go back again. So 3 cc's, okay? And then 1 cc of 2% Lido. No epi. Just plain 2% Lido. You don't want any blanching from the epi. And then, again, 1 minute. And while I do all of this, I normally have my patient numbing. There's really not a lot of like discomfort. That's why we're mixing the product with lidocaine. But it gives them like something to do while we're prepping all of this. Right? They don't feel like they're waiting for nothing. So now we're going to twist, and we're going to let all the little foam go all the way to the top. Okay. We don't want to inject the foam. The foam is carboxymetacellulose, and that's what we think that is what was causing all the little nodules in the beginning, because the reconstitution when Sculptra started was 3 cc's, and then a couple of years later changed it to 5 cc's. So now that it changed to the 8 cc's, we haven't seen any issues with any nodules or anything like that. I've been doing it for probably like 5 or 6 years, okay, of my 15, and I haven't had any issues with it. But I always use this reconstitution diet, that 8 mLs with 1 ml of Lido. And just whenever you draw it, right, try to keep your needle kind of like low so it's not into the foam, and try not to draw any of the foam. And it's going to look like this, like almost like a skim milk, like a very light, kind of like whitish fluid. That's what it's supposed to look. I do 2 mLs on the temple, so we're going to draw that. For the temples, I like to use a 23 gauge needle, 1 inch, because it's shorter, right? It just gives me better control when I do that 1 up, 1 over. So 23 gauge, 1 inch for the temple, and then a 25 gauge, 1.5 inch for the rest of the face. So we draw 2 cc's for the temple. Now we're going to do 2 syringes of 2.5 for the face. And I know that's not the 9 mLs, right? But remember that we don't want the foam, so you're always going to have a little bit left over in the vial, and that's perfectly fine. So you got 7 mLs of Sculptra out of that vial. And I always keep a couple of extra needles because Sculptra sediments so quickly. Sometimes you'll get the needles to clog while you're doing the treatment. There's different little tricks to kind of like unclog the needle, or you can just change it. That's why I always keep better. Sorry, you were like sliding forward. And I'm going to do this side of the face first, okay? And then let you see it, okay? So you can compare to the other side, kind of like your sneak peek.
Yeah.
And I can see kind of like some superficial veins right here, which is normal, right? If I can see them, I just mark them to try to stay away from them.
Sometimes you can even see the artery, the superficial artery, kind of like pulsating nearby, which is kind of like nerve-wracking. So temple first. Since it's been sitting in the tray, right, for a couple of seconds, I don't know if you can see it. So the Sculptra, the polylactic acid, it just sediments so quickly. So every time I'm going to do it, well, if my MA is not helping me, right? If I'm doing it on my own, I like to draw a little bit, like a little bit of air. So you have that bubble in the syringe, and the little bubble is helping you to kind of like mix the product. And once you have it nice and suspended, you can start. And like I said, whenever you're starting, right, you're going to be a little bit slower, which is perfectly normal. So if you're injecting the face and you start to see kind of like the Sculptra sedimenting on your plunger, just go out, do the same, get the bubble of air, suspend it again, and do the rest of the product. Because the least that you want to do is at the end, right, you push all that Sculptra that it's like a little clump of it, and then you can create a little bit of like overgrowth of collagen in one single spot that it's technically not a nodule, but you may see it under the skin. Let me know if you need a break, okay? Little one up, one over. Perfect. Doing great. You're going to aspirate. Perfect. You let me know if you need a break, okay? And then really slowly start pushing your plunger. You're doing great. So with Sculptra, patients have homework. I tell them you're going to have homework. We want you to keep massaging the area for the next couple of days, for the next 5 days actually, coming out. Beautiful. Barely a tiny drop of blood. You did great. So for the next 5 days, you want to be massage the area, okay? We normally tell the patients like the neuromnemonic 5-5-5, 5 minutes, 5 times a day for the first 5 days, okay? And we want to keep that, remember that those crystals sediment so quickly, right? That we want to keep those crystals evenly suspended in the area of treatment. And I tell my patients there's really not a right way or wrong way of doing the massage as long as we do it. I normally say little circles and then kind of like going towards the hairline. Same for the ear, for the lower face, kind of like going towards the ear. And then the other thing that I tell my patients, because we have those superficial little veins on the temple, sometimes because of the pressure that the fluid is creating for the first couple of days, those veins, they're going to look a little bit bigger, kind of like angry. I say that they're angry, and they're going to go away. Okay, they're going to blend again into the skin. Don't worry about it. It's just because of the pressure of the fluid that is there for the first couple of days. It looks so good. You're going to like it. So I don't know if you guys can see it. It's giving her that tiny little kind of like volume. Females, the ideal volume for the temples needs to be completely flat or just a tiny little bit concave. So right now she's completely flat. So it looks really good. And when we revolumize that area, immediately picks up the corner of the brow, because that's one of the reasons why the eyelid starts hanging, right? Because we're losing the volume on the temple. So it's a great treatment. I love it. The Sculptra is my favorite treatment for temples. I'm going to start right here on the preauricular area. And I'm going to be moving your head kind of like in weird angles, okay? Little poke, okay? Poke, poke. Nicely fed, nicely fed, nicely fed. So we want to be superficial, right? We're in dermis. You see the depth of the needle right there. And then I explain to my patients, we lose volume in these areas so commonly, right? It's one of the first areas that we see losing volume. And it's kind of like a very underrated area because patients never look at that area, but that's really one of the areas that is causing the sagginess on the face over here. So retrograde linear threads. You can see the little volume that is creating, which is beautiful. And just fanning the product. And again, by the time you get here, if you feel or you see the Sculptra kind of like sedimenting on your plunger, just go out, resuspend, and come back. And this is the depth that you want. You want to be able to see the Sculptra. I don't know if you saw that, but it was getting clogged. So without coming out, I just pulled back and then readjusted the plunger, and it just gets the Sculptra going again. So you don't have to poke the patient again. So you kind of like pull back and then re-inject. Okay. I have a tiny little bit like a 1 ml. I'm going to do a tiny little bit on the jawline, okay, since we have the product. Nice, deep breath. You're doing great. And look, even with how quickly I did it, you can see a little bit of that Sculptra starting to get kind of like right there on the bottom of the syringe. So I normally don't inject that tiny little bit at the end. Sometimes it's just like a 0.1 or a 0.2. So now we're going to do a little bit right here in the submalar area, and you're done. Jump to the other side.
Could you show us the angle which you did the injection? Because it's kind of hard to see.
Of course, yeah. It's kind of like, what would you call that? Like a 45 degree, I guess. And you're pretty even with the skin because you don't want to go too deep with it. You're in dermis and you have a long needle. So you're kind of like almost like flat to the skin. You go in an angle and then you kind of like almost like get it flat to the skin. I'll show you right here. And for patients, I mean, Amy has a beautiful jawline, right? But for patients that don't have a good jawline definition, you can go in almost like if you were doing jawline with derma filler, you can go and do like a deep injection on the gonial angle of maybe a 0.05 of Sculptra Deep to stimulate that deeper collagen. And it works beautiful. There's indication for piriform fossa, nasolabial folds, almost the whole face you can do with Sculptra. It's wonderful. So now we're going to do the submalar area just a little bit. You see, you go in like in a 45 degree and then you kind of like almost like flatten it completely. That's why I asked her to remove her jacket. And you see I'm staying within that little line, that marking that we did. You're doing great, Amy. Doing great. Perfect. Beautiful. Very good. Okay. Gotta get a little bruise right there. That's it. You did awesome. Okay. So I'm going to do a little massage and then I'll show you. Okay. And I love Sculptra that you can kind of like see almost like how it's plumping everything under the skin while you're doing it. It's wonderful. And it's a fluid. So if you saw any kind of like little irregularities when you're injecting, as soon as you massage it, it just kind of like blends. It's beautiful. Same thing. We're going to raise a suspend. So a little bubble of air. And when I'm doing the consult, Amy barely has any volume loss, right? So that's why she's going to do great with just these 2 vials. If you have a 50-year-old or a 60-year-old that has never done anything, with Sculptra, we follow almost like the same rule as we do with the filler, where we recommend 1 syringe per decade of age. We recommend 1 vial per decade of age. So a 50-year-old may use 5 vials, obviously in separate sessions, right? A 60-year-old will use 6 vials. So 3 treatments of 2 vials per session. If it's a 60-year-old and you know that they have a lot of volume loss and they want to do it a little bit faster, you can. I will do probably 6 to 8 weeks and then you can do a second treatment. Some doctors say even 5 weeks and they're doing the second treatment. So that's perfectly fine because you know they're going to end up using that volume anyway. Okay. Good. Okay. Aspirate and then nice and slowly. Beautiful. Awesome. Okay. So you see, I kept like a 0.1 cc, okay, on the syringe, just to avoid pushing that little extra product that it was kind of like sedimenting on the plunger while I was doing the treatment. Beautiful, Amy. You see how beautiful it looks immediately? I just prefer this technique. I think it's just cleaner. It looks good. Okay. We're going to do exactly the same. We're going to do the preauricular area first. Try not to add too much right here in the middle because we know we have the line of ligaments right there. And then since we added a tiny little bit on the jawline on the other side, we'll save a little bit for this. She doesn't have a lot of like preauricular volume loss, so I think she's going to do great with dividing that product into those 2 little areas. Ready? Okay. Little poke. Pinch, pinch. Doing good, doing good, doing good. Keep it nice and flat. And a tiny little bit of product. I don't even look at the syringe anymore. I'm looking at the skin and how much volume we are creating to determine how much I'm pushing on each line. So I think it's going to vary on each patient. Probably going to be maybe like a 0.04, 0.05 on each line, on each retrograde line. Tiny little bit on the jawline. Just a tiny drop. Doing good. Beautiful right there. Same thing. Okay, dermis. You can see the shape of the needle. And you push the product retrograde. Beautiful. And I keep the last little bit. Even that little dimple that she gets right there, that little laugh line, it's improved on this side just because it's pulling everything. It looks good. Beautiful. Okay, almost done, okay? Okay, last one. Resuspend. Ready? Okay. So we're going to do the submalar area right here. Same thing, trying to stay right in front of that line of ligaments. Little poke. Nice deep breath, nice deep breath. Doing good. Doing good, doing good, doing good. Beautiful. You're doing great. We're almost done. Almost done. Beautiful. I was expecting a little bit of blood right there. You didn't have any. Good. That's good. So at this point, I do a little massage with bacitracin. And I tell the patients, this is going to be your first massage of the day. Remember, you're going to be doing 5 massages, okay? Obviously, tonight it's late already. So if you can do a little massage before going to bed tonight, that will be awesome. Okay. And then tomorrow, start with your first massage, okay? I normally tell my patients, incorporate your first massage and your last massage of the day with your morning routine and your night routine, because it's just the easier way of doing it, right? While you're doing your products or you're cleansing your face, you can use that moisturizer or that cleanser to kind of like massage it. And then just put an alarm on your phone for the other 3 massages. You don't need to have any products in your hands. You don't need to, you can do it with your dry hands over your makeup. It's fine. Obviously, just try to have your hands nice and clean, right? Without touching your face. And then you're going to be doing little circles going toward the hairline. Circles going to the hairline. And then remember that we treated it right here, right? Almost like in front of the ear. So don't forget this area, okay? Because that's important. And then we're going to start right here. Little circles all the way to the ear. Okay. Just trying to put some pressure here so it doesn't get big. Okay. Very good. Right here. Thank you. Okay. Go ahead and relax your head for me. We're not going to charge you for the massage. Thank you. Okay. Little circles. And then going towards the hairline. It looks so good. I think you're going to do great with this temple treatment. I don't think you're going to need any else. After, Sculptra has an indication of 12 to 18 months. So it's a great treatment to kind of like maintain for the patients that understand the importance of prevention and maintenance. I think it's one of the best products ever. Some patients, it's hard for them to understand that they're not going to see that instant gratification like you do with the fillers, right? But it's a wonderful product. Wonderful product. It helps with the texture of the skin, gives you that nice glow, on top of giving you that very generalized volume, which is beautiful. And it's your own collagen that is being stimulated. So it's, for a lot of patients, that makes more sense than injecting the filler. And again, there's no right way or wrong way of doing it, okay? Little circles, little lines. Just remember to do it, okay? So we can keep everything kind of like evenly suspended. Remember, I did a little bit on the jawline, so don't forget the jawline. That's it. And obviously, anytime we do filler, right, a little bit of swelling. You may have a little bit of bruising. That will be perfectly normal. A little bit of tenderness, right? Because especially if you develop a little bruise, that's very normal. Nothing should be painful, okay? Nothing should hurt. If anything hurts, you have to let us know. That's it. You did awesome. Other than that little bruise that you're getting right there, I think that's it. Okay. You did beautiful. Thank you. Sorry that I had to be rubbing your face with a chemical peel. Let me wipe off the lines. Oh, yes. And the bacitracin. And you are good to go. No exercise for the first 24 to 48 hours, just to avoid any bruising or swelling, right? If we increase your blood pressure right now going to the gym, obviously that bruise is going to get bigger.
Okay.
So we don't want to do that. Definitely no makeup, no sunscreen, no nothing for the first 6 to 12 hours. Okay. And that's it.
Okay.
Mm-hmm. That's really it. No dental appointments. No, try to keep the dentist or any vaccines away. As a minimum 2 weeks, I will say 3 weeks or 4 weeks if you can.
Okay.
That's it. And remember, this is kind of like your sneak peek. Okay.
Yes.
Enjoy it. It's going to go away, unfortunately,
Oh, no.
because the fluid is going to get absorbed into the skin. Don't touch it. Don't touch it.
Okay.
The fluid is going to get reabsorbed right into the tissue, which is completely normal. But the little crystals that are there, those are the ones that are going to slowly start stimulating your collagen. So in the course of 3 months, when Sculptra gives you the best result or the final result, you're going to go back to what you see today.
Mm-hmm.
So it's kind of like your sneak peek.
Okay.
Okay. It looks really good.
No, I like
really,
it.
really good.
Thank
Okay.
you very
Awesome.
much.
Any questions? Do you have any questions?
Yeah, we just have a few questions.
Mhm.
What happens, or can you, it says here, we mainly talked about thin patients, but
Mhm.
can you go over who you would feel is best for this product?
Uh-huh. So I think it's really those super thin patients that need the volume, especially in the preauricular area. Your patients that are a little bit more round face with fuller faces, I think they would benefit more either from threads or even some filler in the right areas to kind of like resuspend the heaviness of the tissue. Because Sculptra, what I try to explain to my patients is that Sculptra is not going to give you the sharp definition that the fillers do. Sculptra is going to give you kind of like a more evenly distributed kind of like fullness, which obviously for your fuller patients, you don't want. So, for my fuller patients, sometimes I do just filler on the right areas, right? Lateral, just to kind of like lift a little bit of this heaviness. We can do Kybella. We can do all the things that are kind of like to take away instead of adding, like Sculptra is. Just my opinion and what I do in my office.
And the next question I thought was a good one. Is, out of curiosity, what happens if the patient doesn't do their massages like you request?
So there's really nothing that shows that it will change the treatment. It's just something that we do clinically. Even one time I didn't ask that question, but Chinove got asked that question, the same thing. And he was like, I just tell him to keep doing the massage. It's something that we do. It makes sense in my head just by looking at how quickly that product kind of like sediments on the syringe. So it just makes sense on my head. And I just give the patient that instruction. I don't think anything wrong will happen really if they don't do it. As providers, right, we have to tell the patient do it 5 times, so they do it maybe 2 or 3 if we're lucky. So I just keep doing that instruction. I don't think nothing will happen if they don't do it, honestly, but I just keep doing that instruction, giving that instruction to my patient.